So what do you do if your baby has a nosebleed? First of all, nosebleeds are not that common in infancy. Nosebleeds really start happening as your child becomes more of a toddler. The most common cause of a nosebleed is actually picking your nose. And this usually doesn't happen in infancy. It happens more when the baby is becoming a toddler. And if you ask any child if they pick their nose, they will all deny it. And you say, do you pick your nose? And they will look at you and say, no. And then you bring them to the doctor's office and I will say, which finger do you use to pick your nose? And the child will say, this one. And that usually elicits the cause of the nosebleed. For those kind of nosebleeds, what we usually recommend is that you just put a little bit of petroleum jelly in your baby's nose with a cotton swab twice a day and use a cool mist humidifier. That'll keep that area really moist. If your baby or your child has one area they keep on scratching at or is very irritating, it could be that there's a vessel there that they keep on picking at. This would be a reason to go to see an ear, nose, and throat doctor who might actually cauterize that vessel. But for the run-of-the-mill nosebleed, your kid runs, falls, smashes the nose on the floor, comes to you with bloody nose, what do? You just put pressure on it. Now, when I say pressure, I mean gentle pressure for a full 10 minutes. And you have to look at your watch, because 10 minutes is quite a long time when you're holding a squirming child. But you want to do 10 minutes of pressure, have them lean their head forward, because if they keep their head back, they often swallow that blood. And then they vomit that blood, and that becomes even more traumatic for them. It just really tastes bad is what it is. In younger children, the common causes of a nosebleed often are apparent vigorous suctioning of the nose with an aspirator. When you aspirate the mucus from a nose, you're actually pulling off some of the mucosa of that nose at the same time. It causes swelling in the nose and it can actually cause bleeding. So parents will say, oh, I suctioned the baby with a baby bulb aspirator and some blood came out. And that's usually because they're pulling some of the mucosa as well. If your child has repeated nosebleeds that you cannot stop with pressure, definitely bring it up to your pediatrician. Repeated nosebleeds could also be a sign of low platelets, and that is something you would want to talk about with your doctor because platelets are a clotting factor.